Right, good morning, members, ladies and gentlemen. I will start with item 1, declarations of interest. Are there any declarations of interest? No? Your last chance, right. Minutes of the previous meeting, item 2, they are enclosed on page 1.
I propose we accept them.
Is that seconded? Any further comments? Those in favour of acceptance, please show. Anybody against? That is carried. We move on to item 3. I have no urgent items at the moment. So we'll move on to item 4, which is the situation in Park House.
Sorry? First, we can do an update on devolution.
Sorry. What was? Sorry, my apologies. No. The Chief Executive is here. He is going to speak on devolution.
Chair, thank you very much. I was asked to give a quick verbal update on the what is called the devolution deal, but this is really a Cornwall deal. I think members are aware that government and Cornwall Council and the CCG have agreed a document which is commonly referred to as the Cornwall deal. And in that document there are 7 areas where government intends to give greater or devolve powers to the local area on a number of policy areas. And health and social care is one of those areas where government have agreed to provide further powers to the local area. I think from the onset it's quite important that members do understand that this is a deal between Cornwall and government. It's not a deal with the Isles of Scilly so far. So the official signatories on the deal are Cornwall Council, the Clinical Commissioning Group and the government. Members have debated the devolution prospects and opportunities that could be there for the Isles of Scilly and agreed that at this point in time there is no appetite nor any value if the Isles of Scilly becomes a formal signatory of this deal. However, there are a lot of policy areas that very much, of course, affect the Isles of Scilly. We are one local enterprise partnership area, we are part of one police area, but also we're part of one health area. And so in the deal it is specifically mentioned that the Isles of Scilly must be consulted and we need to work in partnership to assure that the deal doesn't affect in a negative way the Isles of Scilly, or put in a positive spin, it's that the deal actually provides positive aspects for the Isles of Scilly. And I think that's quite important. That means that the members and officers of the Isles of Scilly are involved in the development of some of the implementation plans and the kind of overarching monitoring that is taking place on the deal. If we then move to health and social care, in the deal it doesn't actually specify which powers or what will be devolved to the local area. What it says is that there is an agreement that government will work with health and social care partners to develop a plan, and a plan that then sets out what powers and what responsibilities will be devolved. And that process has now started. So partners have put in place new governance arrangements, and they've created something which is called JSEC, which is kind of a joint strategic executive committee, and that is the overarching body that will oversee the plans going forward and what will eventually be presented to government. In terms of partners on JSEC, clearly the Clinical Commissioning Group is a member. Both local authorities, Cornwall Council and the Isles of Scilly, are members. NHS England, as a key stakeholder, is a member. And and recently the providers have also joined JSEC, so that a joint plan and joint strategy can be developed moving forward. And I think that's quite important. Apart from the devolution kind of implementation plans, what is coming almost like left field is a requirement by NHS England that partners locally develop what they call an STP, a Sustainability Transformation Plan. And this is quite important because the guidelines that have been issued by NHS England are very, very similar in terms of requirements to what is required for a plan under devolution. So therefore, JSEC have now agreed that the Sustainability and Transformation Plan really is the driver for moving forward in terms of planning. And the Sustainability and Transformation Plan covers 5 key areas, and 5 issues are, I think, quite important for that. And the first is that as part of planning, there is a move towards a place-based planning system, rather than just looking at services. Yeah? So, and as a place, the STP will cover Cornwall, the Isles of Scilly, and will have an impact on some areas, North Devon, just on the border, if you like, and of course Derriford is part of the plans moving forward. The second key element on the plan is around integration. It's trying to find efficiencies, but most importantly, better services for clients and residents by integrating health and social care activities more effectively. The third element then, of course, will focus on the estates and how estates play a role in the delivery of integrated healthcare. The fourth area will cover the governance, how the governance of the new model will operate. And finally, it will provide an articulation of the new delivery models, which will be quite different, I think, over the next 5 years. So that's a key piece of work, and that is kind of overtaking the devolution implementation plan. So in terms of the plans moving forward, I think there's 2 key work streams which are important for the Isles of Scilly, and they've just started, so that there's little to update, but the key pieces of work are, of course, then the strategy that will be delivered under the plans. And the second work stream is around the integrated commissioning, and there's a set of plans being developed to provide integrated commissioning for adult services, and a work stream around integrated commissioning for children's services. And I think I'll leave it there for the minute, if there's any questions.
Any questions? Well, I have one, and that is, I hear all you say about integration. What may worry some people is that there may be some issues on which our voice is not heard. Now, how much opportunity will there be for the voice of the council to be heard in Cornwall?
As I mentioned, we do have officers on the individual work streams, the sort of work stream around the integrated commissioning, and both for adults and for children. We have member participation on the monitoring board that will oversee the implementation plans. And myself, I'm a member of the JSEC, which is the overarching governing body, if you like, that's overseeing the planning. So, fairly substantive.
So we'll have a voice.
Correct.
Have a voice. Jane?
Yes, Chairman, through you. If the meeting is covering health provision and commissioning, joint commissioning, integration, etc., I would hope that the Council of the Isles of Scilly reps will liaise with Healthwatch, because we have got a lot of information that we've gathered over the years over services which are commissioned at present for Cornwall and the Isles of Scilly, but are not all delivered here due to geographical restrictions, which we are taking up. But I think it would be helpful if we could liaise on it, because we can provide some information that I think would be useful, A, to you in negotiating, and B, to the population of the Isles of Scilly in perhaps getting some of these services delivered which aren't currently delivered and should be.
Absolutely. Yeah.
Any further questions?
Can I just ask about the place-based planning rather? Is that just for the Isles of Scilly? Are they for individual plans for individual places?
Don't know is the honest answer. What has been agreed so far is that the health area that the plan needs to cover, the sustainability and transformation plan, is Cornwall and the Isles of Scilly, with some of the fringes of North Devon and into Plymouth. But clearly there's going to be an overlap, because Devon will have its own strategic and transformation plan. So we still need to work out the details, what this means. There's going to be a point, once the kind of strategy and some of the new models are emerging, whereby we will have to disaggregate, level down. So what does this actually mean for West Cornwall? What does this mean for the Isles of Scilly in terms of the model that you will deliver? Because we do not require, and probably there's no desire either, to have a one-size-fits-all. So there is scope that we can articulate very clearly what the health delivery model and social care delivery model on the Isles of Scilly looks like. But this is a bit early at the moment.
Thank you.
Could you give us some idea of the timescale of the whole planning coming into operation? Roughly, you know.
It's quite interesting. NHS England have put some fairly stringent timetables around this. And what they have now said is that the STP in draft form, the kind of first round, if you like, needs to be delivered by the 29th of June.
This year?
This year.
This year, yes.
And the reason that's important is that because there are a few key areas that the NHS require the plan to deliver. And one key one is that by the end of next financial year, so by March 2017, the deficit that currently is in the system needs to be under control and needs to be brought to zero. So there are some strict and strong messages coming from NHS England.
And finally, I presume there will be at some stage some consultation with us.
That's correct. A series of public engagement activities are being planned. There is a date penciled for the Isles of Scilly, which is the 22nd of March, but don't take that as a date yet, because it hasn't been confirmed. But that's the kind of provisional date that there will be a roadshow on Scilly.
Are there any further questions? The last chance? No, thank you, Tara. That was very interesting. Right, I'll now move on to item 4, Park House. It's a verbal update. The meeting only occurred yesterday. It was not just discussing Park House, it was discussing care of elder people and so on and so forth. Because the meeting was held yesterday, there's no written report. But however, Councillor Fran Grottick is here, who's the acting chairman of the committee, and I've asked her to do a complete verbal update and answer any questions. Fran.
Thank you, Chairman. I accept that the future of our adult social care provision is an emotive issue, and I'd just like to make a couple of comments as we start. It might seem that this has, if you like, landed on our desks in the short term. However, obviously, some of these issues have been long-standing, and it's just that we are now really looking at service provision in response to a budget shortfall. And let me say that we really don't have any options but to look very carefully at this area. And I would also like to say that it is our office's job to alert councillors to these kind of funding pressures and to suggest options that we might move forward with, and that then it is councillors' jobs to have a close look at all these options and work together with the officers to move forward. Forgive me for stating the obvious, but I just wanted to reassure everyone that hopefully we're all going to work together and further down the line come up with a solution that will be to the benefit of our community and sustainable in the long term. I would also like to state most clearly that yesterday's meeting did not make any decisions, absolutely none. We couldn't. We haven't got the information to our, sitting in front of us so that we can make an informed decision at the moment. And what I am hoping is that in the next few weeks, months, we will have a lot more information which will guide us to the decisions that we'll be asked to make. Yesterday, for those of you who didn't manage to make the meeting, and for those who may later on be looking at YouTube, yesterday councillors were asked to consider two issues. They were asked for their vote on two recommendations. The first recommendation was to support what is called a full options analysis. And really that means, in layman's terms, at least how I see it, and I'm sure everybody does, as having a really good look at the ways in which we could move forward. Councillors were very happy to support that full options analysis, and sitting in the chair, I totally supported my colleagues who asked for as full and wide look at the options analysis as possible. Because it can't just be looking at the issues that we might first of all think of. There might be an authority, perhaps as far away as Aberdeen, perhaps, just to use an illustration, who might have found a really innovative way of delivering a particular service. And so we need to have a really good wide look at all the options. And in order to move this forward, councillors also agreed that it would be good to have some outside help. Gareth Peters, our adult social care manager, acknowledged in his report that we do not have, or would be unlikely that we had the resource in-house to fully do all of this options analysis in-house. So I hope that that will be seen as a very positive thing. As a councillor, and indeed as a member of the community before I became a councillor, I have noted comments that the council have been very perhaps free to pay for consultant help in the past. I believe that some colleagues sitting around this table might have put that particular comment in their election manifesto. However, in this particular issue, I think we do need expert help, and I have spoken to Aislinn Hick, our officer in the field, and she is hopeful that we might be able to find money, possibly from our Better Care Fund allocation, that will help us to fund this work. So I hope that people, colleagues sitting around this table and in the wider community will support a really good look at where we are going and how we are moving forward. And I would say I don't think that this is going to be something that is done in the 6 to 8 weeks that was in Mr. Peters' report. I do think it will probably take longer. And since we are shaping the future of our services, possibly for the next 10 years, I find it quite a realistic aim that we do allow more time, because whatever else we do, we have to get it right. And we need to take a really measured look. And the one thing that worries me is that the funding crisis in front of us, serious and difficult though it is, should not force us to take decisions that we make precipitously. I'm not suggesting for a minute that we would, but I think we have to be very careful to look at all the options. I think we have to accept that our community needs to be fully involved. And I would say that meaningful consultation occurs before you take decisions. You cannot ask councillors to take decisions when they don't fully recognise what their community thinks, even if we have to accept sometimes, I'll be perfectly frank, that our community cannot have all that they would like, partly because of our geographical location and partly because of funding pressures. But nevertheless, we really need to take those views into consideration. I also would like to state that as sitting here in my seat, I don't fully know, and I know a lot of work has gone along in the background, where my health colleagues stand at the moment, I would not find it at all alarming, in fact, if they did not really know where they stood at the moment, because they have to find out, I think, far more detail of where the government is standing with regard, as the Chief Executive has just briefed us, which I must say is extremely useful. We don't know the effect of Cornish devolution. We don't know the effect of all the differences in government funding that will come from a shrinking of our revenue support grant and our reliance in many ways on local taxation. We only have a very small business rate tax base, and so our ability to recoup more money, I accept I may not know the full picture, but my understanding at the minute is councillors will be allowed to retain more of their business rates because they will have less in revenue support grant. For us, that could ring, and I think it probably does, ring an alarm bells. So we're really in a very fluid situation at the moment. So I would like, I hope, I have given the community a little bit of reassurance that we're all going to work together on this, that most of us, if not all of us, accept that we do not have the information available at our fingertips at the moment to make an informed decision. And sometimes I think the right decision is that we're looking at this, but we don't know yet where we're going. We're going to get more information for you, ably assisted by our officers. We are then going to really engage with our community, and please keep March the 22nd free as a keynote in your diary, because Ashlyn Hickes and others are working on a workshop in the Old Wesleyan Chapel here, I believe, so that we can give more information to the community, and our health colleagues are hoping to join us, so it should be a really good day and a really good exchange of views, perhaps some uncomfortable views, but we have to take that on board about how we're going to move forward. So just again to finish on this particular aspect of the options analysis, yesterday councillors did not take any strategic decision. They just asked for full options analysis to look at the whole area in far more depth and where we might be going. I am very happy to talk to anyone that wants to come and see me, ring me up, email me, and so we can keep the dialogue going. That was the main focus of the discussion. I will just touch on the issue of raising the fees at Park House because I think I need to do that. Colleagues made no decision yesterday. From the chair, I have to say, it is a decision that has to be made and made in the short term. It is an uncomfortable decision. None of us welcome asking those who can pay to pay more. However, according to the information that councillors have been given, and I have no reason to doubt it, we are not charging enough to cover what it costs for somebody to be cared for at Park House. Whether it is fair, given the needs that some members of our community have for them to be asked to cover the cost, is a wider political discussion. Perhaps it is fair that some of the money comes from the health budget, but that is not something that was either appropriate to discuss yesterday or that it is appropriate to discuss in any depth now. Again, it's part of a wide-ranging discussion. But in the short term, we will have, I regret, if we wish to maintain the service going forward, and I sincerely hope that we can, it may be in a different place, it may be in a slightly different shape, but my personal belief is that some form of residential care is very essential on these islands because of our geographical location and because of our responsibility to islanders who have lived here and contributed to this community all their lives. The provision of residential adult social care, as has been stated recently, is, I think, part of what defines us as a community, and I would hate to see it lost, and I have to say that. So the question of fees has been left. Councillors agreed to find out more about the effect of this kind of a fee increase on individuals who were asked to pay, and I believe that we have a full council in the short term coming up in early March, and I believe, but I'm not sure, that this issue will have to be revisited then. I regret if this little update, short update, hopefully, is not perhaps as structured as I would have wished, but following on so quickly from yesterday, I'm afraid I've virtually had to do it from the top of my head, so I apologise. Anyone who feels I haven't covered it properly or not in the depth in a particular area that they would wish, please come back to me. And again, to colleagues round the table and folks later on who are going to look at YouTube, all wider members of our community, please engage. We need everybody engaging with us so we can all work together. And I very much thank the chairman of this committee for inviting me to talk this morning. Thank you.
Thank you, Fran. Any questions at this stage? Jane?
Chairman, I have two. First of all, I'd like to thank the chairman of Community Services, or Vice Chair, Acting Chairman of Community Services, for her full briefing on the meeting yesterday. I was unable to get to it because I had another engagement. And I welcome the fact that she stated that on-island residential care is essential. I think we all know the effects of isolation from families and loved ones and the effects of that particularly on older people. What I would like to ask as a question, I don't know whether the chairman can answer me now or maybe investigate, is how much investigation here is given to the continuing healthcare assessments on the NHS? Because there have been various cases with the NHS Ombudsman that have gone to the Ombudsman, and I know in Cornwall there have been cases whereby people with Alzheimer's, it's obviously an illness, and they are eligible for continuing healthcare under the NHS. And how much of this is investigated here? Perhaps someone could ask this, or maybe you know the answer.
Thank you. If I could deal with a quick issue first with your first comment that I considered some form of residential care essential on the islands. I do. That is my personal view. But I also do not discount, as your chairman here this morning knows, perhaps to his cost, putting it down as part of the options analysis. We have to look at it in order for us to be able to give a proper evidence-based comments as to why it is possible that other options are just not feasible or practical. So we'll just deal with that one at the moment. That is certainly my personal view. I have discussed the question of NHS funding with Gareth Peters, our adult social care manager. There are a lot of hoops to be jumped through in order for the NHS to contribute to a person's care. I do believe that some of these hoops have become less onerous in recent times. I believe that one of the ways in which we might receive more NHS support for our residential care facility, or indeed our support to individuals in their own home, is the Care Act of, I believe, 2014, where the whole ethos, rightfully so in my view, is in integration of health and social care. I would say, having worked as a health visitor, that the integration between health and social care has always been done on an informal basis, and the Care Act actually enshrines this in the legislative process and makes it, if you like, a far more formal integration, and we should be working on that moving forward. Gareth assures me that he has looked at the possibility of continuing health funding for our residents at Park House as and when it is appropriate to do so, and I have absolutely no doubt that he has. I think it is part of his role that he addresses with great, I'm choosing my words carefully. He addresses it as a key part of his role to see if funding could be obtained from the NHS, but it has to be done sensitively and we have to keep within the agreed protocols. Are you happy with that?
Thank you.
Thank you. Yes, just to add to that, Alzheimer's dementia is a disease. It's not a question of old age, it's a disease. And diseases like that are dealt with the funding by the NHS. Now, I know there's provision for continuing care and all that from NHS to social services, but if you go out of the NHS umbrella onto social services, then the individual is assessed for paying for it according to the means. Cases have been fought. In fact, I have been involved in one where a person has challenged the funding, and it's been discovered it ought to have been NHS. My main concern is what we discussed yesterday. We have agreed to look at all the options for care of the elderly, infirm, and all that. And we have Park House. When we say we look at all of the options, I was the odd man out yesterday. I went, oh yes, consider all the options, but please do not consider removing healthcare assistance from the islands. For instance, I know Park House is not, ideal, but before we start closing down Park House, we ought to have an alternative means of residential care on the islands. Now, I cannot see any point in leaving it in as an option. It will make people worry because sending people to the mainland means their loved ones and relatives will have to go there and visit them and all the complications of that. So all I wanted the council to, or the committee to do was to say, I propose that removing all residential care from the islands is not an option to be considered. I had no support whatsoever. I'm disappointed. But that's my personal view. I was the odd man out. Fran, perhaps you'd like to...
Yes, I would like to come in there because I think Councillor Bilsborough had very wide support sitting round the table for his, shall I say, for the thinking behind his proposal. However, I personally feel we're very privileged to have a local authority when we are a population as small as we are. And in order to have the responsibility of running our own affairs, we have to show, with great respect, that we can manage our affairs in as professional a way as possible. And we have to think on this one, not only with our hearts, but with our heads. Central government will be looking at how this council responds to a short-term and indeed a possibly longer-term funding shortfall. We have to show to those who are looking at how we manage our affairs that we look carefully at all the options, and you cannot have a full options analysis if you tie up who is doing that full options analysis, if you tie one of their hands behind their backs before they come to the table. That does not mean that most of us will not have very strong personal views about certain aspects that we might be looking at, but we still have to look at them. And that is why I believe Councillor Bilsborough did not have the support yesterday. I truly do not believe it was because he did not have councillors' total sympathy or empathy, if you like, to his point of view. Just to finish, we also again have to look at the wider picture. We are moving forward, community services agreed, with hopeful provision of suitable lifetime homes, could be termed assisted living accommodation on the Carn Thomas site. Carn Thomas may not be perfect, but it's a brownfield site. It's been used before, so therefore it allows us an option of redeveloping it with sometimes less constraints. I'm not an expert in this field, but I'm assured that that is so. If you live in a suitably adapted home, you can have, or a home which is warm and insulated and modern, or indeed not modern but insulated and warm, you can be offered extra care in your home and that will work. If you live in an old granite cottage, perhaps on an off-island, where it is extremely difficult to insulate it, where there might be problems of damp, it might be in your best interest to offer you alternative accommodation on St Mary's. And that might save your need for residential care. We just have to look at the whole spectrum. Sorry for taking more of your time.
Thank you, Fran. No, all I was doing yesterday was trying to get an assurance that residential care facilities would not all be removed from the island. I got no support. Anyway, thank you. Is there any more questions? Colin, yes.
Thank you, Chairman. I think I need to entirely back up what the Chairman of that committee has said, is that members' feelings were that we didn't want to completely shut down older care on the islands. That was not the thing for anybody put forward. In fact, quite the reverse. But, as the Chairman has said, we did need to have that as part of our review, so that when we present this report to outside bodies, we can say we've thought of everything. And that was the reason we went forward with it. But there is no intention of any member of that committee to close down all the elder care on the islands. The other thing I'd like to say, to prepare people a little bit, is that although we didn't take any decision on the fees for Park House, a decision will have to be made soon, and the amount proposed is quite large. And it's quite large because it costs about £1,300 per person per week in Park House, and our present sum we ask is about 500 or 600. So there's obviously a need for quite a sharp increase if it's to be helpful. The other thing that we will have to seriously consider, though it won't help all that much, is taking up the 2% increase in council tax for social services. And that will help a bit, but there does need to be quite a big hike in the fees for Park House.
Hi, Colin. James?
I was just going to say that I think, having missed yesterday's meeting, it's going to be quite clear that the majority of, everybody, let alone councillors, is going to want to retain provision for elder residential social care on the island. But quite simply, from what I've heard this morning, having not heard yesterday's debate, this is a microcosm of the wider issue for the NHS really in this country, isn't it? It's a situation of an ever-ageing population, a situation of people not understanding, perhaps, that you can't spend money you don't have, or else enormous deficits spiral horribly out of control. And obviously for provision of these services for future generations, we have to look very carefully at how we're going to do this. And I think this issue in itself is going to be one of the most challenging and interesting political debates for the whole country, coming up without question in the next decade, as to whether or not we are actually going to be able to provide free healthcare for all forever. And I would say we almost certainly aren't. And at some point, means testing and insurance-related facilities for those that can afford it inevitably, invariably may have to come in, very sadly. Just looking at the demographic, and I think we have to consider all of these things and just work as well as we can over here to make sure that we retain, by whatever means necessary, provision for the residential care. But it is a massive challenge, and it's incredibly difficult for everybody.
Thank you. Steve?
I more or less agree with James, actually, but we come to this impasse regarding fees and charges for Park House because 70% is an enormous hike, but the reason we come to this is because of understandable reluctance over a long period of time from councillors to want to increase fees for people who are obviously, clearly in this instance, old and vulnerable. And then you get the situation, unfortunately, it's landed on this particular council that's got to bite the bullet and essentially charge the current people it affects with years of irresponsible fee setting. I think that's a broad lesson that could be taken across the whole council. The council has been fairly useless at setting appropriate fees and charges over a long period of time, and that ranges from the airport, obviously, to Park House and in other areas as well.
Thank you. Any further comments? Fran, have you anything to say to wind up?
No, I don't think so. I would just say, in response to Councillor Sim's comments, that we will have to increase the fees at Park House, but that this will go, as I asked yesterday, with the hope that the very careful assessment process will be entered into, so that people are not only, we follow all the protocols that we follow now to make sure that people can only be asked to pay when they have the funds to pay, and also that we give them, or facilitate, not pay for, but facilitate independent financial advice for those families who may need it. And there is a ceiling. You can keep, so I think it's 23,000 of savings before you are asked to pay anything. There is then a means testing to make sure you can continue to pay without it obviously impacting too much on your other family circumstances. The wider political debate, as Councillor Francis has said, will continue on, and whether it is fair for people to be asked to pay when others who might not have managed their finances quite so well don't, is an argument for another day. But meanwhile, as Councillor Sims has said, the fees, I think, will have to be raised. But that is really to protect the facility. If we don't, we will have less chance of managing to carry on with what we hold dear.
Thank you, Fran. There's no more questions. You're welcome to stay there, Fran. There may be items later on which would interest your empire.
Thank you.
Thank you. Right. I will now move on to item 5, update on decisions made in previous meetings. It's on page 9 of the report.
Chairman, should we just vote on the recommendation?
On?
Vote on the recommendation in the previous report?
The recommendation, this is just a verbal. I'm on item 5, right?
Members note the update decisions made previously.
Previous meeting, and you'll see that these are on page 9 on the report.
I propose that, Chairman.
Are there any questions before I do that? These are just for note. Being proposed. Is that seconded?
I'll second it, Chairman.
Okay. But all those in favour, please show. Thank you. That's carried. Thank you, Teo. Right. We'll move on to item 6, optometry arrangements. Now, a report. Has a report been circulated to members on this? No. I'm on item 5.
Which is
It
item
said the
6.
report to follow.
6.
Yeah.
6 rather, item 6. It says report to follow. Have you all had the supplement?
Thank you. I have now.
We have now. It's a rather short notice, Chairman.
It's too short notice. I had a golden rule when I was chairman of planning for 5 years. I would not accept reports round the table or extreme short notice unless it was a Third World War. Now, it's not good enough for reports to come out a day or so before or even round the table. Is there any reason why this cannot be deferred until the next meeting? Members can read the report and by all means put questions in. I may well before June, decide to hold an intermediate meeting to clear up odd things which are still outstanding. So I'm suggesting...
what I was getting copy. What agenda item are we talking about now?
6.
6.
We're talking about the item 6, optometry arrangements.
Which is in the supplement, Steve.
I've got the supplement here. This is
Where did you get the supplement?
pack 1
Yes.
on the table.
Right.
And I
will not accept reports around the table.
I believe I had it emailed to me as well.
Well, right. Unless anybody has any questions to ask on this, I will defer it for debate until the next meeting. Yes?
I wouldn't. Obviously, that's your decision as chair, but I'm just looking at the recommendations. I don't think it's necessarily warrants that, given the overall impact of what the decision would be. But however, that's your decision.
What it is saying is that they believe they've overcome the problems that we had as regarding the waiting time. Is that correct, Dan?
That's correct, yeah. They've
Yeah.
cleared the waiting list at the moment, and they are due to a heavy workload over Christmas.
Yes.
The report from the GP to NHS England wasn't managed to reach the NHS till the end of January. So obviously NHS England are now digesting that report and producing options for the direction of travel. The recommendations are designed to enable us to be able to ask NHS England to come back to, so we can examine and scrutinise their strategic plans for the delivery of optometry on the Isles of Scilly to ensure that this situation, i.e. the build-up of the waiting list, doesn't happen again.
Yes, well, any information I get from now on, I will assure you it will be circulated to all members of the committee. But at the moment, it looks optimistic. I shall wait for results of how long people are having to wait.
Chairman, just to keep you
Yes.
right up to date, I'm going for an eye test this afternoon.
Yes. Okay, so that is for note, and it will be on the agenda of a meeting I may well hold before June.
Can I just say again, I think it would be, I take on board it's a late paper, however, given what we are being asked to, the recommendations, it seems foolish to put off requesting a formal representation of new plans for 4 months.
No, it will not be for 4 months. I may well hold a meeting in a month's time. What I will not have is reports virtually around the table.
Well, that's your decision, but I would propose that we accept both those recommendations. So
Right. Is that seconded? It's proposed and seconded. Any further comment? All those in favour, please show. That is carried. Right. Right. We move now on to item 7. SWAS.
Hopefully SWAST
Dan.
will be on the telephone. There's a telephone conference. Hopefully SWAST, Neil Chevalier is waiting on the phone, so if I just go and patch him through.
Right. This will be a telephone conversation. Hopefully.
Slightly ironic.
Hello, is it working now? Can you hear me at the other end? This is not very good, is it?
I can hear you loud and clear.
Have one more go.
Okay, thank you.
Hello, can you hear me?
Yes, I can, Gordon. Can you hear me?
I can hear you. Can members hear the other end?
Can you hear me all right?
Yes.
Okay, that's good.
Okay, right. What we would like, we, the committee, I hope we've all read the reports on this. It seems to be taking time to achieve this satisfactory solution to the problems. Have you any comments on this?
Okay. But hopefully you can hear me.
No.
My name is Neil.
can I jokingly suggest, Chairman, you come and use the Health Watch office facilities next time?
Okay, sorry about that. We shall now move. This again will be a topic of the next meeting, which I'll hold, obviously, before June. Right, so let us move on to...
Chairman, before we leave that, could I just ask a question of the officers, please?
Yep.
I think I emailed Dan Marcus a while back regarding this 4G expected date here. Is there any more information on that?
No more information at the moment, but I don't know whether you noticed the story in the Cornishman at the end of January about 4G
Yes,
being delivered in
Penzance.
Penzance.
Yeah.
I believe, hopefully, with it creeping closer to us, that we will get 4G. The interesting thing about the report from SWAST is that the new emergency services network is going to be delivered via the 4G network. So if we are going to be on that emergency service network, we will have to have 4G here. So it's logically to say that we will be part of that 4G rollout. We can't give any dates to help that, to pin that down, but I can assure you that if we are asked for any help in delivering of that 4G network, then we will go out of our way to make sure that that happens. I'd just also like to say I had a brief chat with Neil on the phone, that he is more than happy for the chairman to have a phone conversation with him about any updates from this paper, and those can be circulated via email. He wanted to give reassurance that things are progressing in terms of the pager system, the messengers, and with the sustainability of the paramedic service on the island.
And then I'll circulate all members. Jane?
At least I think we've alerted them to the fact that we don't have coverage here. And even if the present signals work, we don't have coverage in all areas. So from the gist of their letter here, it appears that they've got this in their minds to sort out as well.
Yeah. We are one of the only rural areas that they cover, so...
James?
Well, I was about to say, I think that there's some very heartwarming stuff coming out of what I'm looking at here, in that if this is the kind of money that people think they need to spend in order to solve a communication problem on the off-islands, and this kind of, quotes and things are acceptable within the wider health service, then by simply looking at the procurement process, we may well have all the money we need for Park House for a long, long time ahead. We need to go to quite simply to a marine electronics shop and buy a couple of satellite phones for £400, job done. It's absolutely unbelievable. And if these figures are the kind of procurement that occurs within our health service, then there's no wonder we have serious financial issues.
As an unbiased chairman, I'll share your view. Steve?
Chairman, can I just say I'm technically not minuting this because you've deferred the item. Is that okay?
Well,
yeah?
I'm just saying, without being specific, the 4G thing is going along quite speedily at the moment.
Right. That's the end of item 7. Item 8 has been done by Teo, devolution. We'll move on to item 9, which was this report, which is in the supplementary pack, which you all had recently.
Again, Chairman, this is an email I received last week, basically about the transition of services from adult community services. Dr. Catherine Hudson just emailed to give reassurance that nothing will be changed and this work will be rolled into the Sustainability Transformation Plan, which will be delivered in 2 years' time. Nothing much to report at the present.
No, we need not make a decision, but of course, members are welcome to answer questions, and anybody who has not time to read it thoroughly, if they send a question in, I shall make sure it's answered. Any questions or comments? Oh, sorry. Right. Could you say who you are to the members?
Yeah, I'm Dr. Ellen Wilkinson, I'm Medical Director of Cornwall Foundation Trust. Obviously it's premature for me to be here on behalf of adult communities health services, as we're not acquiring those services till April. So predominantly I'm here to listen and to get a feel from the islands of what's going well and what's going, where there are challenges. The update is exactly as our commissioners have said. I guess I hope it's helpful to be here and be reassuring about the fact that our focus is actually on safe transfer and transition of services, not about making huge changes. And then really just a small point, which is there's been discussion about a consortium. There is no legally constituted consortium as such. So the language here is more careful, which is around a coalition. So we're the lead agency within that coalition. We will take that responsibility on the 1st of April, assuming that all of the checks and balances that are in the system go to plan. And the transformational work will be done with that coalition over the 2-year period of the contract. And I'm happy to try and answer questions, although, as you can imagine, I'm not a specialist in that field yet.
Any questions? No? Well, thank you very much for attending. Right, we'll move on to now item 10, Health Watch update. Carol.
Can I just ask, before I run through this, the medical escort contingency plans, I think there's a note in the supplement that the committee will be asked to endorse those, but they've been put in part 2.
That medical contingency plan in part 2, I've now decided is in part 1, so anybody can ask questions on it.
There's a little bit in here which relates to that.
That's it, you can do it now, Carol, yeah.
Okey-doke. It's ages since I wrote this because I got my report in early. So now I can't remember what I said. Really, activity since October 15. Medical travel is, as you know, our big ongoing concern, simply because it's what we hear most about. I've just highlighted some of the work that's covered in the medical travel and transport group, and that is a key group which can deal with a lot of logistic problems as they arise, because partners include commissioners, RCHT as a provider, and our transport provider, as well as local problems. They will need to go away. A lot of the work has to be done. Some of these relationships are contractual. A lot of work has to be done outside of the group, but it's a way of monitoring progress on medical travel. The report of medical escort contingency plans was written in response to a recommendation in that group, the medical travel and transport group, that there should be a review of criteria and arrangements for outpatients, appointments, discharge, all the things we hear about. It turned into something else, and it's a document, a good enough document as it stands, but it is just the Royal Cornwall Hospital Trust guidelines for the discharge and transfer of patients to the Isles of Scilly, including escort criteria. And it does the job it has to do within that remit. Health Watch has heard and believes that there are wider issues around travel warrant administration, funding, recharging, certain barriers to access to certain services because of the way that system is set up. And we have written quite a detailed report to NHS Kernow, recommending that guidance and administration are separated, that NHS Kernow takes the lead on developing guidance for travel warrant criteria to and from the Isles of Scilly, and it's separated from the administrative procedure. So decisions are taken at which they are. RCHT didn't put anything in their guidance that they didn't ask NHS Kernow about. We'd like NHS Kernow to take a more in-depth look at those decisions and how they're making them and what they're sourcing their advice on. So that work's gone in. There are two things might happen. Alison Roberts-Davies is considering taking that report as is to the NHS Kernow governing body to look at what NHS Kernow might do, what role they might play, or there will be a separate task and finish group to look at all that. So there's a bigger piece of work, is the short answer. And we've also contributing medical travel considerations and intelligence to the Community Transport Initiative, which is a local initiative, which is really not working with providers as such, but looking at the strategic transport across the board. 3.2, we've had long-standing concerns about not the quality of midwifery provision on the Isles of Scilly, but the service model. We brought these concerns to you about 18 months ago. We took them to the Health and Wellbeing Board about 6 months ago. We had started to write a report to both the commissioners and providers of the service about the service model before the current midwife tendered her resignation. We've finished that report and it's now gone in. My understanding is that RCHT have already gone out to recruitment. They are looking to replace like for like as they must. There will be cover from the mainland in the interim as there was before. And we hope that perhaps they don't experience quite such challenges with recruitment as they did last time. Primary dental care, this is a short-term thing. There's been a 6-month interim period when we haven't had a full-time resident dentist. Our retired dentist is providing limited cover. There are some restrictions on access to routine and elective care under those arrangements, and they've gone on a long time. So we have flagged that up to NHS England, and I'm following that up with them because it's a short-term thing. Once we have a new dentist in post from April, we'll go back to 5-day-a-week service and routine and elective care, but it needed to be flagged up that we went for a long time with limited access, not none, but limited access. Review of physiotherapy rehabilitation provision, that's not a massively high priority. It came out of the community survey report. It was something that people talked about a lot. When people talk about physiotherapy, they could be talking about 3 or 4 or 5 different services. It seemed to us that what they were talking about was they'd like a more flexible and joined up service across agencies and across providers and utilising local facilities and resources better. It's something that I've chatted to Ellen briefly about this morning. It will become part of the new coalition's responsibilities. There's also not a post, but there is a tender going out under the Better Care Fund for enhanced therapeutic provision, and that might be a key part of that. So this is all working together, and it's going to be a long time because so many other things are going on. Hopefully, if we keep talking about physiotherapy, when we're talking about Better Care Fund, adult community health services, follow-on care, arrangements on discharge, if we keep talking about physiotherapy and all those things, it will actually become what it needs to be, a bit more joined up. So that's the kind of tasks that we're highlighting at the moment. What we've been concentrating on as an organisation is improved signposting. We love being in Porthcressa. We're much more visible. We've got much more interaction with people. People are popping in and out all the time. People are used to popping in and telling us things. We'd like to get them used to popping in to ask us things as well, because we've developed a broad range of knowledge and information and who's who and who to go to. We might not be able to provide advocacy and support, but we know who can. We can point people in the right direction if they need help solving a problem. And we've developed a lot of background information about services which are available and how they can be accessed. So we just want to really improve people's awareness that it's a good place to ask. However, whenever we ask people, where would you go for information, they always say the health centre. So we're actually going to be doing some work with the health centre about how we can showcase information up there. And we're working as well with the library because we're opposite, so we've got a nice sort of sending people back and forth there as well. Our priorities for the rest of this winter and spring coming up, we are working with the Cornwall and Isles of Scilly Cancer and Patient Carers group, or at least one member of that group who's been tasked by them to look at the issues that cancer patients from Scilly experience, and the major one is accommodation and the costs of accommodation when you're over there receiving treatment, but also about perhaps better on island support, tying that in with the Macmillan support service that's already available. Medical travel, obviously. Off-island costs there, that is, again, with NHS Kerno, and we are going to rewrite the medical travel report, aren't we, Jane? We are. We are. In that is supporting choice, provision and delivery of commission services, which is what we've been talking about a lot, and I feel very much that one of the barriers to that is the travel warrant system. I also feel, and we've recommended, that actually in every contract and service level agreement with every provider, there should be a requirement: how are you going to deliver these services to residents of the Isles of Scilly? And I think if that would be the key point, that people actually have to think about that, because as Jane alluded to earlier, there is a barrier of access to services. We don't know what they are, because we know that consultants and clinicians will not refer patients to services because they don't think they'll be able to get there. So we need to really look at that, and we're working with NHS Kerno on that. Physiotherapy and rehabilitation we've talked about, and midwifery we've talked about, and that's where we are.
Any questions?
Sorry, Carol, 3.5, you talk about CAMS in the report. Could you, in your updates, you didn't mention that in the verbal?
Did I not?
No, sorry.
3.5. Well, that again, it came from the community survey report. Instances of referral pathway not being as smooth as it should. I think actually the survey was done last May. That was quite early in the sort of new model of provision, with a primary mental health care worker being present on the island. I think it's 2 days a week, working with the school nurse and with school and children's services. We don't hear a lot actually about access to CAMS. I think there is still probably a problem in the referral pathway of who to refer to, and referrals getting picked up and actioned, but I think that's in isolated instances, and I think children's services provide very good support to people in brokering those connections. And we also have the new CAMS strategy, and we heard a lot about that at the Health and Wellbeing Board, and I think that's very much thinking around the Isles of Scilly and how delivering services there. So it's just something that we're keeping abreast of, talking to people about. We were very fortunate that after the Health and Wellbeing Board meeting, we had a brief meeting with the senior CAMS team when they were here, and that was very useful from both parts. So it's just making sure that you are aware of our issues and that those are being raised.
Colin.
Thanks, Sharon. There's a couple of areas I'd like to explore. The first one is this question of the midwife. It seems very unsatisfactory to me that we've got no midwifery service here, because we all know that midwifery doesn't just consist of delivering the baby. There's a lot of relationship and so on needs to be built up beforehand with the midwife. And
Colin, I'm sorry.
Carol, would you like to?
Could I just interrupt? We do have a midwifery service. We have a midwifery service. It's part-time. She provides antenatal, postnatal care. She attends deliveries where people are giving birth on island. That's generally about half of the number of births. Half tend to be delivered here and half on the mainland. It's a single part-time post, and 2 years ago when the midwife retired, it took a year to recruit and fill that post, which caused us some concern. We think there are barriers to recruitment because of the nature of the post, and that's what we've been discussing with the commissioners and providers of the service. Our current midwife is still in post. She's leaving at the end of February. They've gone out to recruitment again, but in the interim, when we haven't had a resident midwife, it's been covered from other birth centres in Cornwall. And there is always, antenatal clinics are attended and taken. There is the usual cover, and as long as anybody on the island is 37 weeks or more pregnant, there will be a 24-hour resident midwife on call. So that they will cover that, and they covered it for a whole year. And we can't doubt their commitment to the islands that they did cover that for a whole year, and the last time we didn't have a permanent midwife. So we do have a midwifery service.
Well, thank you for that. I'm not entirely sure I'm entirely satisfied with that answer. I think having a midwife in Cornwall, if I was a pregnant mum, I'd want to here on the island. It's only a couple of days of bad weather, and the midwife can't get here. I just think we're falling behind on this one, and we do need to make our presence more felt to the authorities that we need a midwife here, or can one of the present nurses train as a midwife so that they're here permanently and know the people?
Colin, I think you find that the cover's a lot more extensive than you got the impression of. I mean, I've just got the impression that if somebody is at 37 weeks, then there is a midwife on the island in case, which is, I think, is a fair bit of cover.
The provision is that we have a resident midwife. We have a resident midwife living on the islands. She covers all the antenatal clinics, and she is on call 24 hours a day when somebody's due to give birth. Our resident midwife is leaving, and as before, the cover that will be provided will be resident, as there will be midwives here 24 hours a day when needed.
Okay, I won't press it any further.
If you like, Colin, we've written quite a detailed report to NHS Kerno and RCHD, and I'd be quite happy to share that with you confidentially, so you can see the kind of issues that we are worried about.
Oh, perhaps I will drop in and see you. But I mean, I was just going on some mothers pregnant mothers who complained to me that they didn't seem to have access to a midwife. And so I'll take that up with you perhaps further. The other thing that quite surprised me yesterday was the present chairman, Councillor Billsborough, said that there was travel vouchers available for intra-island use. I always imagined the £5 fare was just to the mainland. But
no, can I come in there, Colin? I looked up the national legislation on medical travel from the Isles of Scilly to the mainland, and it definitely states anybody on a medical appointment on the mainland will have to pay no more than the £5. Now, in reality, it would sound as though that if we're going to a medical appointment, we'd have to pay no more than £5 going from here to Truro. In practice, people from the islands or from St Mary's have had to pay £5 towards the airfare there. Now, I believe, and I think you'd agree, the off-island people ought not to be disadvantaged. In other words, they should pay no more than £5 from home to the airport at Penzance. This is what we're hoping to achieve. Jane, would you like to come in there?
Yes, Chairman, it is something that the Medical Travel Group has been working on for some time. Sometimes it feels as if we're banging our heads against a brick wall, but I think it is being taken seriously now. The National Health Travel Scheme clearly states that no person resident in the Isles of Scilly should pay more than £5 to attend a medical appointment on the mainland. Now, that doesn't include coming over to St Mary's for what's called primary care, which is visiting your GP or the dentist or something like that. How that's been interpreted in the past is that the £5 just covers, as it was once, the helicopter fare, now the aeroplane fare, and gets you to Penzance. And in fact, it does include travel down to Penzance station on the bus. But that is clearly not the case that it should be. And we have pointed this out for some time, and there are people working on it at the commissioning group now, and they are taking us seriously. There's a lot of work going into it, and I know the local GP is involved, Dr. Garman's involved in it as well, and they are looking at means whereby to make it equitable to everybody. But at the end of the day, I think, certainly for a mainland appointment, and I know the local GP practice is hoping to get a bit more out of the commissioners, but certainly for a mainland appointment, we have always been generous with the NHS here in that we have been prepared, generally everybody has been prepared to stand the fare from Penzance to wherever you're going, on the grounds that this £5 will get us up to the same conditions as someone in Cornwall. If we really wanted to push it, we could turn up with our travel warrants and demand the fare from Penzance to Truro, but nobody's thought that's fair on the NHS, so we haven't done it. And I don't think anyone intends to do it. But where it is completely inequitable is that someone on off island, if they've got to go, say, for a consultation on the mainland and they're trying to do it on a day trip, they've got to pay for a special boat backwards and forwards from St Mary's to the off island, which is going to cost a lot of money. Now, that's not in accordance with the travel scheme. And if they've got an escort or they have a regular appointment they have to go to on the mainland, it's not that many people, but there are people that are having to do this. And this is wrong. And this is what we've taken up. We are hoping for progress by the next meeting of the medical travel group, which is in March sometime, as I recall. If not, we have advised the providers that we are minded to refer it to HOSC formally. We haven't done that yet because we're hoping to sort it out anyway. But if we do hit a brick wall again, I think it's going to end up with you.
Yes, to back our case, the national legislation states that no more than £5 for people on the Isles of Scilly. Vice Chairman, would you like to?
My question was exactly as Councillor Daly to Carol, but actually it was fully answered and I was delighted at what she said because I had not misread it, but I had the same assumptions as Colin. And I also agree with the point you just made about the travel. Why should we expect somebody to get to Penzance and then go on again for free, if you like, when if you lived in Penzance, you'd have to pay for yourself. So I think we all get a jolly good deal, but yes, there is the point about off-islanders. But myself, I think if you live on an off-island, you're prepared to live on an island, you have to perhaps contribute a little bit more, if you can. If you can.
Colin?
Well, I've often heard that argument about if you choose to live on off island, you should be a second-rate citizen. But I don't agree with it because we pay the same council tax, the same income tax, all the other taxes are exactly the same. They don't say because you live on an off island, we'll let you off half of it. So I think we should demand the same services.
Absolutely.
And the other thing that I would ask the Health Watch who are quite to be praised for pursuing this, is that there's also the question of getting from the quay to the airport. Taxi costs quite a bit to go up there and to come back, and I think that should be included as well.
Well, it's the same for everybody on St Mary's unless they live at the airport, though, isn't it?
Most people on St Mary's have got their own car or can catch a bus
anymore, really.
Whatever.
Steve?
I was just seeing the travel stuff in here again. I mean, it's just, you say you bang your head against the wall. It must be like painting the Forth Bridge, really. However, I think that metaphor no longer works because they've got more durable paint now. But there was a lady, I think it was in the probably autumn HOSC, I don't know, specifically came in and talked about it, and she seemed to take it all on board. And I thought it was very, very positive, and perhaps it's not moved forward at all since then. I don't know. I thought it was in the process of total resolution.
Oh, don't we wish? Don't we wish? The medical travel and transport group will always need to be there because there are logistical things that come up. If one partner changes the way they do things, it's got a knock-on effect for somebody else. There'll always be things that come up. I think banging your head against a brick wall is probably not fair. Being patient and being prepared to revisit things that you've talked about before. I think actually Health Watch Isles of Scilly punches above its weight with some of our mainland partners. We're talking about a very small group of patients in their, you know, in their scheme of things, but we are listened to. And I think we just have to do what I said, we just keep talking about things all the time in the right place, at the right time, with the right people, and we get there. But the Medical Travel and Transport Group will never be finished. It's a very, very useful partnership group that can deal with problems as they arrive, and then the bigger strategic stuff just takes longer.
This is possibly a question for you as well. I mean, does the reorganisation kick it all back into touch again? I mean, that's another thing.
No, not at all. It doesn't make any difference. Hopefully, when we come to talking about arrangements on hospital discharge and transfer, it might make it easier because of the coalition.
Jane,
Yeah,
before James comes in, Jane, can you have a go?
Just to set Carol's mind at rest, when I said banging my head against a brick wall, I was referring...
My head.
I could have said painting the Forth Bridge, as you say, Steve, absolutely right. You go round and round, and the thing is, as Carol says, it's ongoing in that problems are cropping up all the time, and this is part of this. We'll deal with it later in item 10, the escorts and the travel contingency plans and what have you. The whole thing is fluid. When I say banging my head again, we'll never get there, but we do get there on different items eventually, and then something crops up and we've got another item to deal with, and that's how it works.
James, you've been very patient. Come on.
Well, no, unfortunately, it was slightly about the previous issue, which we moved off. But I also think that Jane and Carol should be thanked, obviously, greatly for all the efforts they put in. I think it's fantastic for the islanders that they're keeping, our best interests at heart and working on our behalf. But going back to the off-island travel question, I just briefly think that we might slightly be. Colin is very admirable, and honourable in sort of fighting for the cause of the off-islands. And obviously, we do need to consider their additional challenges, but it may be just an element of common sense. You can't necessarily have your cake and eat it. There are people who live in places like St Maurs and Tor Point and so on that, if they want to go to a consultancy insurer, they might have to get on the King Harry ferry and so on. I know it's significantly less cost than ordering specials, but I don't think we can delve so far into taxis from the quay up to the airport necessarily. There just need to be a common sense here to bridge that gap, I think.
It's just a case of getting them to recognise, say they, responsible, the legislation of the £5, and I'm sure that Healthwatch are doing their best to get them to overcome the logistics of it.
I think just to clarify the Healthwatch, we don't often take a position because we represent what we're told and what we hear about and what matters to people. But if we do take a position, it's on parity of access. Now, the health care travel cost scheme recognises that our high travel costs as islanders to the mainland is a barrier to parity of access. So that gives us a level playing field in practice with people who live in Penzance. I think the same analogy can be made that very high travel costs via a special at unscheduled times of the day between the off-islands and St Mary's for the first leg of the journey also represents a barrier to parity of access, and that's all that is happening here, that just taking that extra leg into account in terms of how much does it cost patients to access healthcare on the mainland.
Right. This committee does have the power to do something about this. If nothing has been done about it satisfactory, it will be an item on the agenda of the next meeting.
Only if we refer it to you, Chair.
That's going to be a referral process.
It will be a referral, but at the end of the day, I think we all want action, not words. It's gone on long enough.
And it is being progressed, and we will get an update from NHS Kerno at the next Medical Travel and Transport Group.
Thank you. Any more? Jane, have you anything to say on Healthwatch stuff?
No, all been said, I think. That's it.
Fran, have you any questions on what's been said? No? Any questions from them?
No, thank you, Chair. I think that was
I don't really have a question. I just wanted to thank Carol and Jane for a very comprehensive report. Yeah, well done. It's mostly, and apart from the contents, I can read it without a magnifying glass, so thank you.
Carol's the one that's produced the report. I just do the shouting.
Yeah. The work plan attached is just a copy of it's what it is. It's our working document. Right. It's how we keep track of where we are and what we're doing. It's just got the latest updates on it.
Right, now, before we do the budget, there's an item 12 in part 2, medical escort contingency plans, which are in the supplement. Is there anything on this which Healthwatch would wish to add? Jane?
Yeah, Chairman, I think Carol's covered it mostly in our joint report. But the point I would make is that we are very disappointed that RCHT have developed this and put it through their board and agreed it, and it's the final version. Whereas at the last HOSC meeting, and if anyone looks at the YouTube recording, it's quite clear that I asked Mr Masters, if Health Watch would see the draft version of this before it went to the board. He clearly answered yes to me, and we didn't see it. It went straight to the board despite our requests, repeated requests, and we didn't get input into it at that stage. And the matter is ongoing in that we're taking up elsewhere now.
Well, this is for information, but again, you can ask questions on it.
But
Steve?
has that been a significant problem? I mean, has your lack of input impacted on the outcome? Or do you, I'm just wondering on the basis of how is it worth pursuing?
Yeah, I think if you go back to the this is a revamp of existing guidelines. When Nick Masters became manager of the Patient Transport Office, he was looking at guidance and he was looking at practice and he was wondering why things had changed. And that was because certain things in the original guidance had been superseded by practice. So it was suggested jointly that it would be good to review the guidance in terms of 3 years of delivering the administration of the system to get it right. So that's what he set out to do. It wasn't as all-encompassing as we'd all hoped and they'd hoped to do, and it became what it is. It's guidelines for staff. There's stuff in here that has just been copied and pasted from previous documents, and I doubt if it's going to mean anything to anybody anymore. But that's actually the thing that I forgot to tell you in my update, is that we did have a visit from the Quality Improvement Manager and the Patient Experience Manager from RCHT came to visit Scilly in September. And one of the recommendations from that visit is to make a short video, an hour journey video, that can go in the staff library. And so when staff are asked to consider a patient's ability to board and self-evacuate, what does that mean? They can actually watch somebody getting in and out of a Twin Otter or an Islander and actually see what we're talking about. So I think this is the bare bones of some staff guidance which needs to be filled out. The gaps need to be filled in, and I think that will be happening within RCHT. We can follow that up through the patient experience group, and the context for this and the guidance that informs this needs to be reviewed by NHS Kerner, and that's the other piece of work that we've asked them to do.
Jane?
In addition to that, when they, as Carol says, when they came over, the first thing we did was take them down and look to show them the key steps down to the key that people have to negotiate if they live on an off-island. And they were, shall we say, fairly impressed by it, if impressed is the right word. And this was where the idea for the video came from. We're still waiting, you know, it's going to take time, obviously, it can't be done overnight. But I think they realise the problems. The other thing I was going to say, as Ellen's here, is that obviously this will have to apply to other hospitals that patients go to from here who may or may not be, I don't know, maybe they are, but they may or may not, we haven't heard that they're not, may or may not be aware of the problems, specific problems of getting to and from the islands.
Could I suggest you include in it getting on a trip about on Briar on a very, very low tide? Yeah. That'd be quite interesting.
Right. If there's no more to say on this, we'll move on to budget. I'm sorry it's taken so long. Next time, budget, Rachel, I shall take the budget early to avoid you wasting an hour and a half with us. Right, done. Let's start. Item 11, page 33, budget monitoring. Done.
This paper has been prepared by Rachel and myself to present the current budget state and proposed budget for next year for the Health Scrutiny Committee. As you can see from the appendix, I think, Rachel, would you like to take people through the appendix?
Right, Rachel.
The main things we've done with the HOST budget is reallocated staff more appropriately, which is something that we've done across the authority. So although it looks like quite a drastic budget cut, it actually isn't. It's a reallocation of staff time to be more appropriate. And the actual weightings of that staff time is in the main body of the report. We've also increased the transport budget because we are anticipating that there will be some work done with the devolution deal, as Teo outlined earlier. We've made a small saving by cutting down the goods, supplies and services budget. It was felt that it wasn't necessary with this budget in particular. I'm happy to take any questions on it.
Right, so it appears that by having a close look at the staff effort required, we have made a savings on the coming year. Dan?
Not the staff effort.
Well, so sorry. Staff,
where the
that's a wrong
staff
word.
costs are allocated.
Costs of staff.
Yeah.
Yes. All right. Yes. Rachel.
I can go into more detail on that if you'd like. We were finding that one particular senior officer post was apportioned completely to HOSC, and actually that officer worked across a few earlier areas and supervised staff in this area rather than worked fully on this area with all their activity. So as part of the budget setting process, we sat with every budget manager, every budget holder, and made sure that the staffing allocations were appropriate. It's so important with this particular budget that we've set because staffing is one of the biggest costs of the authority.
Yes, we know this. We are fortunate that we don't have the problems, say, the Finance Committee on costs. So, Steve.
Just a question. Is it actually a real saving, or has it basically the costs have moved into another folder?
I wouldn't say the staffing reallocation was an actual cost saving or a cut. The cost,
I'm not moaning. I was just for clarification. Really.
No,
Thank you.
that's fine. The cost saving has been made on goods, supplies and services, which is offset slightly by the transport and travel costs. So although there's been a slight actual cost saving in this budget, it's not huge.
It's not a sleight of hand, Steve. If that's...
So can we have our money back, Chairman?
Pardon?
Can we have our money back for previous years when we've been charged for this? And
it doesn't work like that, unfortunately. Right. Any further questions on this? There isn't. Therefore, thank you for your attendance. I declare the meeting closed at 11:35 now. Oh, sorry. Sorry.
Yeah.
Sorry. We have to agree. I'm sorry. Carried away.
I propose the recommendation.
second, Chairman.
Proposed and seconded to accept the budget as laid out. Those in favour, please show. Those against? Any abstentions? Thank you. I declare the meeting closed at 11:35. Rachel, next time there's finance, I'll do it at the first to save you wasting time. I hadn't realised. It's my fault. It ought to have been... Okay.
Yeah, go and say hi.
Yeah. Anyway, thank you. Yeah. Thank you, Fran.